Bromley Healthcare is an NHS spin-out, and it now provides all of the community services in Bromley. We have a 5-year contract to provide services to the NHS, health visiting, district nursing, getting people out of hospital quickly. We're a social enterprise, so we're driven by the quality of our services, not by profit. To give you an example of what that means in practice, £200,000 of our profit has gone into buying a technology which increased the productivity of district nursing by 20%. In a private company, that £200,000 might well have been taken as a profit.
Thinking about the differences that becoming a social enterprise has brought, there are several things that really strike me. First of all, that this company is owned by the staff, and the staff are empowered by managers to actually make service improvements and use resources in the best way for patients. We are now able to plan and budget very much more rationally, and a practical example of this is we're able to carry money forward across years to, for example, backfill people who are going on maternity leave, which previously wouldn't have been possible, which then means we've got continuity of clinical delivery. We're now able to really rapidly implement new ideas within services that will benefit patients. So a practical example of that is in podiatry. Under the NHS, we're able to provide one set of insoles, but generally speaking, people have more than one set of shoes. So now we're able cheaply to provide other sets of insoles that the patient is able to purchase. We're able to be much more joined up with other partners and the voluntary sector than ever before for the greater benefit of patients. So, for example, we work closely with Carers Bromley to ensure that people caring for our patients with very complex medical needs also get their support, which in turn benefits the patient. The result of all this is now our clinical staff are more freed up to provide excellent quality services and frontline delivery rather than being held up in bureaucracy that doesn't directly benefit our patients.
The NHS spends about £10 billion on community health services in the UK every year. This means that as a business, we should grow. That's the carrot, greater freedom because we're no longer in the NHS and the ability to grow our business. The stick is that £10 billion of business will be very attractive to the private sector, and we will get a lot of private sector interest and private sector competition going forward. That's a great thing because that will drive the quality of services, and that means that the NHS will get better services for less money. I'll give you an example of this. Since we've become a social enterprise and we've operated in a competitive market and we've had the freedom to evolve as we've seen fit, we've seen our productivity go up 15% in the last 2 years, and it will increase a lot more than that over the next couple of years. We've also seen things like do not attends, i.e. people not turning up at appointments, reduced from 15% to 5%. And that's because with the freedom of being a social enterprise, we've put a massive focus on increasing our performance, increasing our productivity, and increasing the quality of our patient care.
Since we've become a social enterprise, we've introduced the iNurse, which is a new way of working. We work remotely, which means that we have all the information for patients at our hands while we're in the patient's home. We don't have to keep coming back to base. As a caseload holder, I'm able to caseload manage and organise the caseload a lot better. I can, via the iNurse, send out a visit that has just come in to a nurse that's in the area, making us much more efficient, much more effective. To access patient information, it's really simple. You just go onto the patient name. There's a list of your patients that come through. When you're en route, you simply just press a button and you press en route. That gives you the time that you've started your journey. And when you get to the patient's house, you just put arrived. You get all the patient's details, you get the telephone number. So if you're standing outside a door you can just press a button and it will ring the patient inside to tell her that you're outside, because some patients don't answer the door because they're not sure who it is. It tells me the NHS number, the age of the patient, who was the referral, so I know who referred the patient. Then I can go on to another screen which gives me a summary of all the details of this patient, and it tells me that this patient has a leaking elbow and the patient needs full notes that needs to be put onto the team planner when that nurse gets back. I've got basic patient information as well on here. This just tells me that she's hypertensive. That gives me an idea of what her current medical condition is. So that's the eye nurse.
The most interesting thing about the social enterprise is that both everything and nothing has changed. Nothing legally has changed in the sense that we can't now do things that we couldn't do as an NHS organisation. And yet everything has changed in terms of our culture, our performance and our productivity. As a consequence of that change, a lot of new ideas have just sprung up which have had absolutely nothing to do with senior management. The people who run the services have thought about things which would just be good for patients, and they've got on and made those improvements themselves. Someone watching this film might say, okay, all of these things could happen in an NHS organisation. My response to that would be, well, they didn't. And this is the whole point. You need to put in place something which allows the culture to change. If you can get the culture to change, the performance will change. There's perhaps a preoccupation in the NHS about detailed structural and organisational change. Where you get the real benefits is from cultural change, because NHS organisations are large and they tend to have thousands of employees in them. And unless you get those thousands of employees to change their way of thinking about things, nothing's going to change.
Part of my role is in the assessment and treatment of leg ulcers. A leg ulcer is a wound on the lower leg or the foot which fails to heal with standard dressings. Without the correct treatment, ulcers can have a significant effect on a patient's quality of life. The symptoms associated with ulcers can include pain, heaviness in the lower leg, itchiness of the skin. There can be smell associated with these ulcers and frequent infections. What Bromley Healthcare have done is to implement clinics to provide early assessment for treatment with leg ulcers. By providing early assessment, the healing times can be reduced from sometimes months and years to weeks.
I suffered from ulcers for at least 12 years to my right leg and 4 years to my left leg. Been in a lot of pain and been hard to control. I've been going to the clinic once a month and having them dressed by a new system they've been doing, K2 bandaging, which has been extremely successful. And I'm hoping that by the end of this year, I will be near enough cured.
As a nurse specialist, to be able to reduce the healing times of ulceration for patients is something that we're very proud of.
The NHS has to take notice because of what we're achieving. We're achieving huge increases in productivity. Leg ulcer healing rates down from 21 weeks to 5 weeks. Do not attends down from 15% to 5%. Productivity up 14% in 2 years and up 20% in district nursing, our largest service. And we've achieved all of that through a change in culture.
The introduction of the balanced scorecards has really made it much easier for us to know what's going in the organisation, right down to an individual staff level. They understand what's on their scorecards and they know how they should be dealing with those. It's made us much more productive. It's made staff think about what they're doing and how they can improve the services that they're giving. One of the differences being in a social enterprise has made, certainly for me, is that we can take responsibility for looking at things that happen within the NHS, but thinking practically what we can do about them, how we can best respond to them. So a good example in my field is the Equality Delivery System, which is the NHS response to the Equality Act. We have to collect information and be able to evidence that we are working with the 9 protected characteristics across the board. 2 things we focused on this year. One is updating the induction loop system we have in our clinics to make that a less hostile environment for people with hearing disabilities to come into. And the second area that we've worked on is setting up a new mum and babies group for the Somali women in the borough who weren't accessing our existing services. We're really excited about that.
I'm very proud of the culture and the cultural change, and of having created an organisation in which people now understand that it's their responsibility to make things better, and they're making a whole load of things better without ever telling me. So I keep finding new and better things about which I know nothing, and I love that because I now have a culture of freedom and personal responsibility and growth. I don't have a top-down bureaucracy in which everything has to be ticked off by me.